What challenges did nurses face during the Civil War? What challenges did nurses face during the Civil War? This is a fascinating topic that reveals the resilience of women during a time of great upheaval. Nurses played a vital role in caring for wounded soldiers, but their journey was filled with obstacles. First, many nurses arrived at hospitals with little or no formal medical training. Most were women who had never practiced nursing before. They had to learn on the job, performing critical tasks like changing dressings and feeding patients. This lack of preparation made their work incredibly stressful. Next, the physical and mental demands were immense. Nurses worked long hours in overcrowded and unsanitary conditions. They cared for severely injured soldiers, which took a toll on their emotional well-being. Their duties included cooking large meals and maintaining hygiene for many patients, all while dealing with the chaos around them. Health risks were another major challenge. Nurses often faced exposure to infectious diseases due to unsanitary conditions. At that time, germ theory was not well understood. This meant that practices like hand-washing were not always followed. Many nurses became ill themselves, putting their health at risk while caring for others. Additionally, sexism and social barriers were prevalent. Women nurses often encountered skepticism from male doctors and military officials. Many doubted their abilities and questioned their place in military hospitals. Female nurses had to prove their worth in a male-dominated environment, which was no easy feat. Inadequate facilities and resources added to their struggles. Hospitals were often overcrowded and poorly equipped. There were shortages of medical supplies and proper accommodations, especially for women. Military authorities were hesitant to provide separate facilities for female nurses, complicating their ability to work effectively. Emotional strain and isolation were also significant challenges. Many nurses were motivated by personal connections to soldiers, such as family members or friends. However, the constant exposure to suffering and death weighed heavily on them. They often found themselves isolated from their own families and support systems. Lastly, the roles and expectations for nurses changed throughout the war. Initially, military medical departments preferred male nurses. However, the overwhelming number of wounded soldiers forced a shift, leading to the acceptance of women in nursing roles. Women had to adapt quickly to the demands of battlefield and hospital nursing, which varied greatly depending on the situation. In summary, Civil War nurses faced numerous challenges. They performed critical medical care without formal training, endured harsh conditions, risked their health, and overcame gender biases. Despite these obstacles, their contributions were essential to the care of soldiers and helped shape the evolving role of women in medicine during and after the war.